So my first question, how has COVID affected your work and the population that you work with?
That's a great question. So as you know, our name is Tri-County Mental Health Services, but we actually serve 7 counties of the state. And we have services that deploy into the community as well as into people's homes, and also folks that historically come to us to receive services. And while we have done some amount of telehealth over the years, we've been providing telepsychiatry for about 20 years. We were not providing telecounseling. And there was a number of reasons for that, to include that federal regulation and state regulation didn't really support it in the way that it needed to. All of that flipped overnight in the midst of COVID transformation. So within 3 days, we literally moved all of our staff into their homes with essential equipment and had them start providing telehealth services. So that's probably the single greatest change that has been made. And as you might imagine, that has different impacts for different folks. Some folks have enjoyed that, being able to be in their home and receive services through telephone or televideo. Other folks, not so much. And so that is kind of the juggling we're doing right now, trying to figure out who needs to come in and how do we make that happen.
Right, wow, that's insane. So that kind of leads me into another question, which is, how has your daily routine changed since COVID started?
So for me, my daily routine hasn't changed as much as others because I have been coming into the office from day one. There are days where I'll stay home just because I have back-to-back Zoom meetings and there's no need for me to move through the agency, but that's pretty rare. What has changed is that a lot of my work as the CEO of this organization was in the community, at the state, in front of the legislature, negotiating contracts in Augusta, flying across the country for quarterly trade association meetings where I serve on 2 boards, national boards for our particular industry, and all of that has just ceased. So I am grounded either to my home or to this agency, which is radically different than what I'm accustomed to. And it has been hard for me because I'm definitely a people person who enjoys the social connections. And I also believe that the best relationships of trust between providers and the people they serve is built when you can be in person and really take that energy and build relationships.
For sure, for sure. All right, so how has your business structure adapted or changed?
I'm sorry, how has our business structure?
Yeah, just like how you, I guess, how you get, your clients or anything, how do you like advertise your business to people who might need your help?
So the advertising is still pretty much what it was in terms of we are on the state's website for behavioral health services. We are on the 211 resource site for providing behavioral health services. We do print ads. We have actually pulled back all of our pamphlets for obvious reasons. You don't want people touching things in the current space that we're in. We do media ads, so we are in newspaper, radio. There have been some TV spots, so we have been active participants in our community as part of the shelter program that was established. And so there were newspaper and television interviews that we participated in. So lots of different ways. We also have a Facebook page, which has a tremendous following, and we'll place things there that also get spread about. And of course, word of mouth. We've been here for 70 years. We are actually celebrating our 70th anniversary this year.
Oh, wow. That's so cool. That must be kind of a hard way to spend your 70th anniversary in like kind of a sticky situation with not being able to.
Because it would have been a great big gala. So we had a big event planned with a silent auction and lots of food and a band and dancing, and none of that will happen.
Oh, that's so awful. It's just such bad luck.
It is, well, yes.
Yeah. So my next question is, what has been the hardest part of trying to meet public safety guidelines?
Well, that's a great question. There are lots of things we didn't know, right? So we
Mhm.
scrambled to create a very detailed return to work policy and service policy. So we also have programs where we serve folks in residential. So we have 4 residential homes and we have 23 clients across those 4 residential homes. And as you might imagine, not everybody was excited about wearing masks or wiping down surfaces on a regular basis. And when you work with the population we work with, one of those populations being seriously and persistently mentally ill, it's very difficult to have them fully understand in some instances why all of this is critically important. And even within staff have had different opinions about face masks and universal precautions, and is this real or is it not? And so all of the things that are happening in the community are happening inside the organization as well. And so it's constant conversation, education, encouragement, and just the hope that in the not too distant future we're going to have some resolution, that there'll be a vaccine, that things will be able to get back to some level of pre-COVID normalness, and trying to keep that hope alive while folks are struggling to keep moving forward.
Yeah. Have you found that it's more, I guess, more difficult to like make connections with your clients like over Zoom? I mean, you're doing, I guess, like in person, like with facial coverings. Is that, but when you're over Zoom, is it harder to like make connections with your clients and try to get them to like be honest with you and everything?
I think Zoom is okay. I'm a trained therapist. I spent years delivering direct service before I moved into administration. And I'm a firm believer, me personally, that nonverbals, body movement, the way someone's shifting in their chair, the way their face looks, are they moving their hands, a lot of which you cannot see in Zoom video, has a tremendous amount of impact on how you perceive that person and how well they're doing or not. So I think there is something missing there. My greater concern is that not everybody has access to technology. So not everybody we're serving can even engage in televideo. So it's telephone, that's it. So imagine you and I are chatting and all we have is 2 phones between us. I can't see you, I can't see your facial responses, I can't see whether your body is tightening up or you're withdrawing or you're leaning in. All important parts of how we do behavioral interventions. And so I do worry. And it's one of the big conversations I'm having with my staff right now, especially little kids. Can you imagine trying to keep them on the phone for upwards of an hour? Not happening.
It's so hard.
So that's one of the places where I'm leaning in with staff and saying, we got to find a way to safely deliver services in the office so that we can really reach these kids and meet their needs.
For sure, for sure. So do you meet with clients over Zoom? And we just asked this question. Is it difficult to connect? I guess I just asked that. So,
and keep in mind that Maine is a very rural state and we don't have a lot of broadband here. So even if folks have laptops or desktop computers or smartphones, there is often no broadband that supports them connecting to the agencies. So it's a smaller percentage of folks that we're actually able to reach through televideo.
yeah, I've heard that's a problem also with students going to school over Zoom for like the past spring that we haven't been able to connect to internet to get into class, which is so sad.
It is.
All right. So has the pandemic taken a toll on the mental health of people who struggle with addiction, and has it maybe given them more time to focus on recovery? Do you think it's kind of like given them more of a resource to get back into it?
I actually think it's been very hard on the recovery community. In large part, people who live with substance use disorders, when they move into recovery, they really rely on those social connections. So think about AA as an example, where you go and you're sitting with other people who are struggling with the same things or similar things to what you're struggling with, and you make those social connections and someone sponsors you. And so when you're struggling, you reach out to them and maybe you spend time together, and all of that got shut down. So while there are virtual groups, keeping in mind, not everybody has technology and not everybody has broadband connection, it's far less substantial than when you're able to meet with people in vivo. So we've seen a lot of relapse. The good thing that has happened is that for a lot of those folks who, show rates in that particular field are pretty low. So it's not uncommon for us to see upwards of 40 to 50% unkept appointments. And the appointment connections have actually risen because people are not having to worry about transportation or childcare. They can stay in their home, they can dial in. So that has been good. But we are seeing that folks are using more because they are feeling depressed and anxious and socially isolated. And so it's kind of a 6 of one, half a dozen of the other. And we're trying to make sure that we're doing everything we possibly can to include going out into the community and connecting with folks.
Mm-hmm. Wow. I mean, that's really great that you're trying to maybe reach into connections that are like in person, because I feel like over as you're saying, like over Zoom, it's super hard to, you know, like connect to people who are maybe in substance abuse disorders because they're looking for like some kind of like happiness in their life maybe. I don't know, it's just kind of hard to have that connection with someone over Zoom. But
Yes.
So that's actually all the questions that I had written down, but if there's anything else that you want to that you want to say to like talk about how you've changed or adapted.
I think one of the hidden impacts is that we have providers here that are providing supportive services to people in the community so we serve the entire lifespan, children to older adults, the seniors in our community. We have residential programs, we have programs that go out into the community, folks come here to see us. And the hidden part of that is that we're providing supports to folks so that they can stay hopeful and hopefully get well, stay well. Meanwhile, our staff are experiencing all of the same circumstances. So not unlike medical professionals, they're on the front lines and they're providing these supports, but they're also experiencing increased depression, increased anxiety. They have children at home they're trying to homeschool with, or trying to provide services to others. And so there's this parallel process that's taking place where folks in the community are struggling and we're trying to support them, but then our staff are struggling as well. And we're, as leadership, trying to keep them feeling hopeful and moving forward and knowing that somewhere down the road, there will be a resolution to all of this. So that's been really challenging. And there's been a whole lot of talk, both stateside and federally, about compassion fatigue and vicarious traumatization, which is what happens to professionals in the field who are providing care for others, and the impact on them has a significant toll. So just something for others to be aware of, that really there are layers of this that are happening.
Yeah, for sure. All right, so all right, I think that concludes the interview. So I'm just gonna stop the recording.